all of you for coming and joining us. A very short, sweet one about this conference. With us today we have Mrs. Ruby Aluwalia, who is founder of Sanjeevani Life Beyond Cancer, and also Dr. Sita Kant Ghanekar, who is a very, very senior oncologist. First he was in Bombay, and now he is in Goa. So without wasting more time of yours, I would just show you a small little clip, a small video, and then we'll carry on. Welcome, welcome, please come.
For 3 days with 9 sessions. Hello, if you or anyone in your family is going through an experience of cancer, we at Sanjeevani Life Beyond Cancer, we are conducting a workshop for 3 days with 9 sessions, where you will learn about cancer, you will learn how to deal with it. You will get to know what works, what all you need to do while going through an experience of cancer, what to eat, what not to eat, how to change your lifestyle and come out of this experience of cancer completely, physically, psychologically, and mentally. So if you were always confused, there was chaos in your life because the disease of cancer has come, then please join this workshop and understand how to work on yourself along with the medical treatment so that you become cancer free at the soonest. For the workshop, please click the button below, register to get to know more. The dates of the workshop are 16th, 17th and 18th of April.
Thank you, Ravi. Thank you. May I call Ruby ji to please come, and Dr. Ghanekar, please. Yeah. Ruby, just a small request, if you can share about yourself, about Sanjeevani, and about the conference with everyone, that will be great.
Good evening, everyone. Thank you so much for being here this afternoon. I will take you through a personal journey of mine for a little while. I am from the Indian Civil Services, 1987 batch. And so I have been a part of bureaucracy for a very long time as my career. In 2009, when I was posted in Bombay, I was diagnosed with stage 3 breast cancer, which had become metastatic. So it was a very, very aggressive cancer, and I went through my treatment in Tata Hospital in Bombay. The journey of cancer for me was as horrible, as torturous as it is known to be. And but one thing which used to bother me is that I am going through this journey with all the resources that I had. But in Tata Hospital, I would see so many people who were going through a similar journey or maybe worse without any of the resources that I had. And that is the time when I decided that I wanted to do something in this field for the underprivileged cancer patients. And my doctors used to tease me, telling me that you are in stage 3. If you survive, then you can think of doing something. So by God's grace, I did survive. And it took me 3 years to get back to my feet. And when I did, and I joined my work back, I also set up Sanjeevani Life Beyond Cancer. Today, Sanjeevani works on the whole spectrum of cancer care space, starting from prevention, going to patient assistance, and then the physical, social, financial, psychological rehabilitation of the patients. So we have a lot of projects which have been developed over the years. The journey of the treatment is over. Presently, Sanjeevani is working in 30 government and semi-government hospitals across 15 states of the country, and we have worked with more than 11 lakh patients by now. In fact, this year, I think we would be working with around 2.5 lakh patients. Every year, our bandwidth has been increasing. 2 years back, I thought that this work of Sanjeevani and my own job was becoming difficult, and I need to make a clear choice. And that is how I took an early retirement from my job. And now I give my full time to Sanjeevani, and I have relocated to Goa, and I live in Goa now. This conference, the National Integrative Cancer Care Conference, has been on my mind for a very long time. And this year, when we thought we should conduct it, I thought of doing it in Bombay, frankly, initially, because there were a lot of resources which were available to me in Bombay. But then I thought, I'm living in Goa now. Now Goa is home, and cancer is increasing at probably the highest, one of the highest rates in Goa, the percentage increase in cancer. So look like that this is the place where this narrative needs to be put out. Now, what is the narrative? The narrative is this, that after I completed my treatment and I went to the doctor, I asked him, what do I need to do so that I don't get a recurrence of cancer? Because I would see so many people getting a recurrence. And he told me that there is no medicine to stop the recurrence of cancer. That day I thought to myself that becoming cancer free is one thing, but remaining cancer free is totally a different thing. In becoming cancer free, the whole of the medical fraternity stands by you in a very beautiful way. But remaining cancer free has to be my own personal journey. And that is how the introspection, the reflection, the conversations, and the research around cancer started for me. And I figured out that immunity has a huge role to play in this disease of cancer. And if we can handle the immunity, if we can keep it at a reasonable pace, then we can handle cancer. And the three things which handle immunity is our whole food science, the whole breath science, and the whole mental construct science. So that is how the journey started. This conference which is happening in Goa, the effort is to bring everybody who is in the cancer care space together on one platform. So we have doctors who are coming from all over the country. We have people who are in the field of nutrition, people in the field of psychotherapy, people into the field of yoga, and everybody else who is into this healing space for cancer is coming together to put out this narrative that what cancer needs is to work together so that the cancer care becomes patient-centric. We also have patients who are coming from all over the country, and we are doing a 3-day workshop for them, which would involve a lot of sessions around the 3 pillars that I talked about. So the effort, again, to reiterate, is to create this new narrative in cancer care, which is integrative cancer care. Along with medicine, what all does one need to deal with cancer and come out of it successfully? WHO says that 1 out of 7 Indians in the coming years will go through an experience of cancer, which is a huge number. And if we need to deal with it, we need to know the right pathways. So this is my story, and I would love to answer any concerns that you may have.
Why do the doctors don't spell out what nutrition or whatever it is to the patients when they come out from this? What is the hidden agenda?
No, I don't think there is a hidden agenda. I think doctors are trained in medicine. They are trained in this. What is the medicine which needs to be given for which ailment? And there is a separate body of experts who are called nutritionists, who know how does nutrition work and what do you need to do about it.
खाली ब्रेस्ट कैंसर के लिए ये रहेगा या टोटल सब अलग अलग तरह के कैंसर?
हम लोग सब कैंसर्स के साथ काम करते हैं, मेल्स एंड फीमेल्स बोथ, बिकॉज वी सी कैंसर डिफरेंटली, isn't it? So अगर कैंसर का क्योर सेम है तो फिर then we need to work with all cancers.
Current situation now?
Sorry?
What is the current situation now with cancer?
One situation, see, the population is 14 lakhs as per the census. What I am reading is that 100 out of every 1 lakh patients are getting diagnosed with cancer, and this is increasing at a very high rate. So the numbers may look less right now, but the rate of increase is very, very high.
Excuse me, sir.
Pinpointed the reasons for this?
Reasons everywhere are the same, actually. Reasons are, of course, the kind of food that we are eating. But more important than that, we talk a lot about the food that we are eating. But what is very, very important is that what we are eating, are we able to digest it? And our digestion, it depends on how our mind is working. And these days, all of us, we remain in constant state of stress. We may not even realize that we are in stress, but all of us are in some kind of anxiety, anger, guilt, fear. These are the kind of emotions which are guiding our lives on an everyday basis. And this stress which is there, it is changing our whole biochemistry. So we are right now very bothered about the environment outside and making every disease, as if the responsibility is of the outer environment. But what about the internal environment, our own internal environment? Are we working on it? Are we understanding it? That is important.
The registration is open for all. How do we go to registration?
For the conference, registration is open for all. It is free, but registration is mandatory.
कॉन्फ्रेंस में कैंसर पेशेंट ही आ सकते हैं या दूसरे लोग भी आ सकते हैं?
नहीं, बल्कि कैंसर पेशेंट्स तो आएंगे ही, बट उसके अलावा वो सभी लोग
जो इस बारे में एडवोकेसी कर सकते हैं। तो अभी जिन लोगों ने रजिस्टर किया है, दे आर डॉक्टर्स फ्रॉम हॉस्पिटल्स, दे आर academicians, then there are students who have registered. So everybody who has an opinion and is happy to put out their opinion and understand this narrative, because cancer तो अभी ऐसा नहीं है ना कि उसी की लाइफ में हो रहा है, अभी तो कैंसर हम सबकी लाइफ में फैमिली में कहीं ना कहीं हो ही रहा है। तो ये नैरेटिव बाहर जाना बहुत जरूरी है, और वो लोग जो इस बात को समझ सकेंगे और आगे इसको ले जा सकेंगे, एवरीबडी शुड अटेंड।
So which is much higher, food or stress?
Absolutely stress.
And that's the most difficult something to solve.
That is the most difficult thing to understand. Number one, to understand stress. Number two, to acknowledge कि हाँ मुझे है. And then the third thing is to look for the tools which will help you. See, if I tell somebody कि अब आप स्ट्रेस लेना छोड़ दो, आपको कैंसर की बीमारी, डायबिटीज की बीमारी, आर्थराइटिस की बीमारी, हाइपरटेंशन की बीमारी सभी स्ट्रेस की वजह से हैं, तो आप स्ट्रेस लेना छोड़ दीजिए। तो नहीं, स्ट्रेस लेना ऐसे नहीं छोड़ा जा सकता ना। सो यू नीड टू लर्न द राइट टूल्स कि जब मुझे स्ट्रेस होता है या जब मुझे एंजाइटी होती है तो उस समय पे मैं क्या करूं ताकि डैमेज टू माय बॉडी एंड माइंड इज मिनिमल।
You will acknowledge that stress is driven by a lot of hate.
And hate is driven by fear. Actually, the whole spectrum of emotion that human beings live on is fear on one side and love on the other side. And all of us are somewhere in between. And the more we are towards fear, the more the negative emotions. And the more we move towards love, more the positive emotions.
Thank you. So thank you. Looks like no more questions. 2-3 things, if I may add to what Rubiji said. The conference is on 18, 4:30. His Excellency, the Honorable Governor, has very kindly consented to inaugurate the conference. He would be here. I think he feels very strongly about the subject, and therefore he said that I would like to come and he will be sharing his thoughts. 3 panels are there in the conference. The list is there in the folders that you have. Just to name a few, Dr. Sudeep Gupta, who is the director of Tata Memorial Center, which controls all the 7 Tata hospitals, he will be joining. Director of Tata Memorial at Bombay, he is joining. Director of Tata Memorial at Punjab, where there are 2 Tata hospitals, he is flying in, he is joining. PGI HOD Medical Oncology is joining. We have the medical superintendent of SMS Jaipur. Very eminent oncologists would be there on the panel. We also have Dr. Gauri Rokam, who is the foremost nutritionist in this country. In fact, I am told most of the nutritionists have studied under her. So she has very kindly consented to come. We have a lot of other people. The Dean of All India Institute of Ayurveda, Dr. Sujata Kadam, would be joining. So it's going to be a very, very good panel for this discussion and this conversation to start. This is the first time this kind of a conversation is happening, not only in India, anywhere in the world. That as to how the so-called medical treatment and the other forms of treatment can come together and really put patient first. So this whole conference is about patient being the first thing. Patient first is what the motto of the conference. This is a conversation, it is starting, and I am very sure over the years this will bring more and more results. What Rubiji also mentioned in the passing is that it is the vision of Sanjeevani to have Goa as the leading center for integrative cancer care in India. We are also looking at building a skill development institute in Goa. We do a course, over 13 batches of that course have happened, but we are looking at building a physical skill development. Then, what is the skill development? It is where we train cancer survivors to become cancer caregivers, because we believe they are the best person to give care to anybody. Like Madam was talking about home care. You know, a survivor who has been trained to become a caregiver is the best person to give care to anyone. So there are a lot of plans, and just to close, thank you so much for coming. Today is a chutti, but you guys took time off and came. Absolutely grateful for that, and also inviting you to kindly join in on 18th at 4:30, because whatever said and done, anybody could be on the panel, but you are the guys who are the biggest influencers in the country. What you write matters. What you spread makes a difference. So please use the power that you have that day to spread the message of integrative cancer care. Thank you so much, and we have some tea and balushai for you outside.